A bone graft must be hydrophilic. Hydrophilic means by imbibition attracting and liking fluids. It has to be favorable for the blood to come in. It has to have ability to be revascularized. Revascularized so we can have all the cells necessary come in through the blood and basically biologically go make this bone go through metabolism. It has to have enough body and be hard enough and large enough to maintain the space of our defect in time of healing. And it has to be resorbable because ultimately our goal is to have all this bone that we placed in a defect to be resorbed and to be replaced with patient's own tissue. So what we did was we categorized bone grafts into two simple categories. And it's a little different from what you guys are used to. We categorized it into porous and non-porous bone. And this particular classification is based on biomechanical and behavioral characteristics of the bone graft rather than the origin of the bone graft, which is what we're used to and what we've been taught in schools. Now, a porous graft is a graft that will basically allow blood to come in and go through all the pores inside of that graft and completely vascularize it, so be totally biologically viable. And it will create a pathway, like a little freeway for all the blood to come in and carry all the cells of the bone metabolism, such as osteoblasts, macrophages, osteoclasts, and etc., and to populate this graft, and to go through a process of apposition and resorption, basically causing this bone graft with time of healing to go away and to be replaced with the patient's own bone. Whereas non-porous graft has a completely different way of healing. Non-porous graft will basically not allow all the blood to come inside the particles. It will go around the particles and establish circulation around them instead of inside of them. Therefore, a lot of times, this graft may be encapsulated and not completely vascularized. So let's take a look at an example of these grafts. On your left-hand side, you can see a typical hydrophilic graft. This is a Krios large particle cancellous bone here. You can see how it's inviting to the blood cells, how it's completely wet with the blood here. And you can see that the picture on the right-hand side where it's completely resistant and hydrophobic to the blood, not allowing to flow inside these particles. So hydrophilicity means osteogenic potential. That's what we want primarily in our graft. So just to give you a little summary of what porous and non-porous graft characteristics are, is porous ideal graft has to be resorbable. As we said, has to be replaced by patient's own tissue. It has to be intra-connected. Intra-connected, again, goes back to that complete revascularization of the blood going inside the bone particles and the pores of the bone particles. And these pores have to be at least 300 microns large. Now, I'm not talking at all about the particle size. I'm talking about the pore size inside each particle. And this is very important because our blood cells are about 50 microns large. However, osteoblasts are a lot larger. And in order for them to come in inside those bone particles, it has to be at least 300 microns or larger. It has to have large particles. Large particles maintain volume of the defect, creating this protection during the healing time and to have the replacement of the patient's own bone. And they have to be cancellous. And again, non-porous graft has all the opposite attributes of the porous graft.